Pleasure to speak with you. So Mark Khalil, I head up one of our digital businesses within Roche. So the Clinical Insights digital business, I'll share a little bit around what we do with that. But Roche just introduces an organization, is a healthcare company, 125 plus years actually in healthcare. There's two main divisions, one that's focused on medicine, so pharmaceuticals, if you will. The other is focused on diagnostics. In fact, we're the number one diagnostics player out there, IVD diagnostics, that is. And increasingly over the last decades, we've been leaning more and more into digital health, which is an area that is continuously growing and a focus for us also at a division.
I don't detect a strong American accent on you either, so I come all the way over to Orlando and I speak to an Aussie, but you mentioned you've been here for a while.
Yeah, so actually I'm from Sydney originally, left about 24 years ago. Did the usual sort of trips through the UK, and I lived in a number of other countries, but I've been in the US actually for the last 10 or 11 years.
Yeah, long enough. Yeah, no, that's good. And so you gave a very high level of Roche and the different areas and focus points, but it's interesting, the digital space, probably a pretty familiar name in the healthcare side because of the different verticals or however you want to describe them within Roche. But tell me a little bit more about where you fit into that digital space, because it's really interesting.
Yeah, so actually, as I was alluding to, we've been in the digital space for quite a while, but increasing our focus around three main areas. So one area is around sort of digital infrastructure, as we refer to it, which is really trying to sort of tackle some of the challenges that we still see in healthcare around, data integration, data interoperability, security, privacy, things like. Of course, with our portfolio that we have as a diagnostics environment in our labs, this is an area that is a must for us, and we have been making quite a bit of investments in those areas, but we're increasing those also outside the lab. So that's one area. The other area is really sort of around what I would refer to as operational excellence, and this is sort of a pretty broad suite of products, which is trying to drive increased automation of large systems. So, lab automation, workflow automation within the lab, but also analytics types products that allow sort of be that lab directors or the likes to understand where do they have opportunities to be able to drive more efficiency in their end-to-end workflows. And then the third, which is sort of the business that I'm sort of responsible for, is in and around sort of medical insights. You've kind of called it insights, and there just to speak a little bit about our portfolio. So we cover sort of three main segments. One segment's focused on clinical workflows, and we focus on those clinical workflows in key sort of indication areas. Oncology is an area of strength for us within Roche, and so that's where we have sort of the deepest portfolio, I would say, where we have a number of different clinical workflow products, and I can sort of go into some of those in a moment. But we also have clinical decision support solutions, and those sort of range from things like how do you bring into the clinical workflow more and more awareness of the latest guidelines, or, being able to match a patient to an appropriate clinical trial based on their indication and the likes, but also a growing portfolio of algorithms, clinical algorithms that have been validated, which range also from indication types, but also the nature of whether they're supporting screening decisions, diagnostic decisions, or monitoring also. And then perhaps the last point here to highlight, which is sort of a younger part of our portfolio, but fits in quite nicely with our ambitions moving forward to drive more and more deep anything, is our remote patient monitoring sort of portfolio, where we all know that care more and more is being decentralized. Patients becoming more engaged in their own care, and we all know patients spend more time at home than they do obviously in hospitals, and so we're trying to sort of connect those two settings, if you will, between the provider setting as well as the home setting, and trying to drive more longitudinality in that.
It's interesting hearing about, obviously, strongly rooted in the lab side, as you mentioned, for Roche, where, I guess the fundamentals of the business, but you also said that, the digital side's been going for quite a while. Sometimes they're quite different vehicles to drive, but I guess it's what brings it together, I think, would then be the data and the insights, and while it might be on the outside seen as two quite different beasts to tackle, I guess bringing those two different capabilities together can bring probably some unique strengths there that allow you to do some pretty cool things in healthcare. Am I on the right track here?
Sure. I mean, actually, so maybe to even bring it back to the So Roche, as a pharmaceutical company as well, we're always dealing with data and dealing with a vast amount of really complex data as part of clinical trials. And so we've been managing data for a very long time, but more in the context of translational research. And so we're acutely aware of the type of data sets, the complexity around those data sets and how to manage them. What we're trying to do, though, moving forward is really support around disease management. And so, with a deeper understanding of the clinical indications that we're operating in, we're also trying to look at where can we support, not just with tests, diagnostics and things of the like, but actually in the coordination of some of that care. And we're doing that, of course, in a very agnostic way, and realizing at the same time that, the way that you manage care in one country versus another is different. So there's a level of sort of inter-country variability, which we have to sort of make sure that we design for in our solutions. But that aside, we're really trying to sort of drive more clinical actionability for clinicians. And this is sort of where the decision support piece really probably takes more of a focus for us.
Yeah. And I imagine then thinking forward, thinking into the future, and I guess what you can do with this capability, and it sounds like there's some exciting projects ahead. What have you got your eye on in terms of where you see the application of these capabilities could then lead to even more innovations within the healthcare setting? Where can we see Roche playing in the next kind of 6, 12, 24?
Yeah, I think you'll see more and more innovation in, the space of, let's say, algorithms. And I sort of use that very loosely, but algorithms are widespread, they're everywhere. But really algorithms that can sort of drive, if you will, different level of actionability downstream. And I think the reason for that is that the data, and you alluded to this yourself, the data is continuously growing and expanding, right? We're capturing more and more information around the patient. Sensors are sort of a bit of a cause around that, but also you look at the way that the information is being captured now more digitally in systems than where we were sort of 2 decades ago. It just allows us to be able to sort of derive more signal out of the noise.
Yeah.
And so an area that we sort of see a lot of promise is around algorithms. How do you sort of start to see more and more clinical algorithms incorporated into routine clinical care that drive, more precision sort of with the actionability around how you manage those patients. So that's one area. I think the other area that's really exciting as well is in the remote patient monitoring space, for the reasons that I sort of alluded to as well, where more and more information is being captured around the patient outside of the sort of classic care settings, right? Patients becoming more engaged. And so with that, also there's an opportunity to sort of reimagine sort of how different stages of that care journey are managed, where, today maybe a patient is sort of spending extra time in the hospital than they need to. They can be discharged earlier, monitored remotely. And you get this new term emerging around digital sort of therapeutics or, remote patient therapy kind of thing. And that's an area that I see will continue to grow, and this is an area that we're leaning into.